Hello, welcome everyone to the session How to Build Skills as a Founder, Lessons from Charity Entrepreneurship. The talk will be held by Ben Williamson. He works as the Director of Recruitment at Ambitious Impact, in short, AIM. Ben was an Incubate in the Charity Entrepreneurship program, where he co-founded Maternal Health Initiative, an evidence-based non-profit focused on care to women and children during the postpartum period. Prior to this, Ben also founded the research organization Self-Help. As a reminder, if you have questions for the speaker, you can submit them via the SwapCap app, and we will have a Q&A at the end of the session, and Ben will also have office hours in the room Catherine right after the session. And now, give it up for Ben. Thank you.
Hello, I am Ben Williamson. I am the Director of Recruitment at Ambitious Impact. I'd like to chat to you guys a little bit today about some of the things that I have learned, that we have learned through our work, about what makes a really great founder of any kind of entrepreneurial project. I have a lot of experience in the charitable sector, but also we have work that we do in the for-profit area. And I think a lot of these kind of skills and ideas that we're going to talk about today apply no matter what kind of entrepreneurial project you might be looking to start. A little bit more about who I am. This is a picture of me from when I ran the Maternal Health Initiative. This is at a little hospital in northern Ghana, where I worked for about 18 months. We worked with the Ghanaian Health Service, so with the National Public Health Service of Ghana in West Africa, to test a new post-birth healthcare model. That's a fancy way of saying that we were there to train healthcare workers on the better provision of information and access to contraception specifically. I started this charity in 2022 through the Charity Entrepreneurship Incubation program, which I'll talk about a little bit more in a moment. And we ran this for about 18 months. We ran a large pilot that reached about 40,000 women to test out a newer model of how to provide this information and access, hopefully to ultimately increase access to contraception for women who wanted to access these services. We shut this charity down last year, and so this is why I am now no longer running this organization. There is a long-winded version of that, which I would be very happy to chat to people about during the Q&A or during my office hours afterwards. The short version is that the area of work that we did, we decided that the specific intervention was not as promising as we thought it was. There was evidence to believe that this might be a really great thing to invest in and do when we started, and that's evidence that we collected during the process of running the organization changed our minds about how valuable this was compared to other areas of work and led to the decision to close down the organization. I now work at Ambitious Impact, or AIM for short, and we are a charity that incubates new entrepreneurs. So this is what we do. We run two main programs. The Charity Entrepreneurship Incubation program, which is the one that I did. You might have, if you came to the Opportunity Fair yesterday, hear me talk about this a little bit. This is a program where for anyone who might be interested in starting their own charity, we provide everything that you might need to do this. We provide the mentorship, the training, the research, and the funding to go and launch an organization tackling really important problems in the world. More recently, we started a for-profit equivalent of this. So launching companies that are either producing products that have real social value, or where the company might be doing something that is, let's say, not bad for the world, but is more explicitly focused on the growth and profit potential, but the founders have made a commitment to donate a proportion of the money that they make to charity. And so we see a lot of social value in the potential donations that could come from the founders' earnings. We've incubated more than 40 charities in the last 5 years. You can see some of the different logos of these, mostly in either global health and development or in animal welfare. In global health and development, there are a variety of different areas, things from kind of health policy, working on anything from tobacco reduction, tobacco taxation, to providing oral rehydration solution. So some of our charities work on very specific interventions in very specific target areas. So working in hospitals in northern Nigeria to provide oral rehydration solution, which is a kind of immediate treatment for chronic diarrhea and is designed to prevent deaths from diarrheal disease. To much kind of larger areas of work, the Happier Lives Institute, for instance, is a research organization that has pioneered research into prioritizing interventions based on the well-being that they produce and improvements to well-being they produce rather than health or income outcomes. Our very best charities are helping tens of millions of people, or in the case of the animal organizations, a couple of billion animals. And we are very excited about continuing to grow this program and to launch new organizations. We're launching another 5 in about a week, and we run this program twice a year. So we launch about 10 organizations every year. 10 organizations means 20 new founders, and so today I want to talk to you about some of the lessons that we have from training these founders. Every founder who comes through our program receives 2 months of full-time training, and then we provide a lot of mentorship and a lot of ongoing kind of access to and support with these founders. So learn a lot about the ups and downs of their process. I'm going to talk about 3 main things. So some tools, some behaviors, and some practical steps. Let's start with the tools. I want to talk to you about kind of 4 main things: the use of theories of change, the leveraging of evidence, our favorite kind of pet tool at Ambitious Impact, which is using weighted factor models to quantify the decisions that you make, and then how to develop better kind of heuristics and instincts about how to make good strategic decisions when running a project. So let's start with a theory of change. This is your overall understanding of what the problem is that you're trying to solve and the steps along the process to how you solve this. I think this is a really important place to begin, no matter what kind of project you might be trying to launch, is to really understand how this product or how this intervention is going to translate into the outcomes that you want. I think it's very easy to see this maybe as a 2-stage process: build project, build product, have value, have impact. In reality, most things are more complex. And mapping out this complexity really helps you understand where the potential weaknesses, potential uncertainties are in the model that you have. So this is an example of a relatively simplified model of a theory of change. This is for the Maternal Health Initiative, for the charity that we ran, that I set up. And so to talk through this a little bit briefly, we have on the most left-hand side, I think for you, we have the actions that you take. So these are the inputs that you have as a founder in your day-to-day work, the most immediate thing that you are inputting into your work and producing. And then on the far right-hand side, you have the impact. What are you ultimately trying to achieve in people's lives or in the lives of animals to make the world a better place? One thing that I think is really important about a good theory of change is differentiating between outcomes and impact. There are different ways of putting this, but basically differentiating between something that is an intermediate metric of success and the actual end-line metric of success that you care about. The charity that I started, the Maternal Health Initiative, is a very good example of this, because this difference is the reason that we decided to close down the organization. So we were focused on providing better access to contraception for women who might want to access these services. And that's a really good intermediate metric of how well our program is working. Is the rate of contraceptive use going up? That's quite easy to measure, and it's quite easy to track. It's quite easy to compare to other programs. Is our program more or less effective at increasing contraceptive use than other programs that work on similar problems? the crux of this is that increasing contraceptive use is not a value in itself. That contraception isn't an inherent good. It is useful because it has additional benefits. And it is easy to make assumptions about what those benefits are and that those benefits are happening. And it's really important, I think, to when you are mapping a theory of change, and why a theory of change can be very useful as a starting point, is to unpick those assumptions and realize that there is maybe something else that you are ultimately optimizing for. So in our case, contraceptive use is valuable because if a mother does not want to have another pregnancy, there are reasons in which this is like quite a significant impact on her autonomy, on her well-being, and on her health if she then does have another pregnancy because she did not have access to contraception. And so we can model those benefits. We can model the reduction in maternal mortality that comes from mothers not going through pregnancy in lower resource hospitals or locations where they did not want to actually have that pregnancy. And we can model the same things in terms of the potential loss of earnings or the potential loss of kind of freedoms and broader autonomy from these consequences. With our work, to try and keep this on the less technical side, our work focused on providing contraceptive access in the post-birth period. So in the first year after birth. And this is a period that we targeted because contraceptive use drops very substantially in this period. So it looks like when you're purely looking at this intermediate metric, that this is a really good opportunity for impact and for a program. That there is a large gap compared to the normal rates in the number of women who are using contraception in this period. Through our programming, we came to the appreciation, to the realization, the evidence is not perfect, but we're like fairly confident of this, that increasing contraceptive use in this period does not actually translate to effects on pregnancy. There are two main reasons for this. In West Africa, where we were working, most women abstain from sex for like the majority of the first year after birth. And most women are breastfeeding to a very like frequent degree. Both of these things, one very self-obviously, one slightly more technically, provide good protection from pregnancy. And so the additional benefit of a mother using contraception is very low. Their likelihood of getting pregnant anyway was very low. And so us providing them with contraception is making a very marginal difference in the likelihood that they would actually get pregnant. That's quite a like tangent into the details of this, but I hope is an example of why it is useful in this way to really understand what the end-line impact or the end outcome is that you want from whatever you might be building. I think some other kind of products, particularly maybe on the commercial side, can be a little simpler than this. This gets quite technical, quite medical, but I think it's still worth really trying to map this out. Some of the theories of change that our charity founders will build as well will have a kind of similar model to this, but they'll have made it a little bit more nicely color-coded. And the reason for this is you can model the relative certainty that you have for different steps. So if I'm very certain that training healthcare workers to provide contraceptives and counseling should increase access to contraceptives and counseling, then I can like have confidence that that isn't an area of my theory of change that I need to investigate further. But maybe when we get towards some of these end-line outcomes that we were talking about, that I might model these as a lot less certain. And that's where I might want to investigate these things a little further. Doing that investigation then comes to a matter of leveraging evidence and leveraging evidence quality. This is a table that my friend Morgan, who's our research director, loves to put everywhere that he can. This kind of is a very neat and relatively simple explanation of kind of scientific evidence from the most rigorous to kind of the least rigorous. Different types of projects or programs that you might run are going to have different kinds of evidence that you might be drawing from. So if you're building a commercial product, you might not be using randomized control trials and meta-analyses to quite the same extent, but I think the principles here apply no matter what the type of program or intervention you might be building is. that there are better and worse forms of evidence for whether how large your problem might be, how good your solution might be at fixing this problem, and investigating how good your evidence is as a starting point. You've identified a problem that you think is worth solving. How confident should you be that that problem is the size that you think it is, that it really does need fixing? And investigating how good your evidence is for this is a good starting place for understanding how confident you should be that the problem really does need fixing or is the scale that you think it is. It's a lot of wasted time, money, effort if you start building something for a problem that turns out to be quite different or of a different scale than you thought it was when you started. And the same thing applies to the solution that you might have. If you have an idea for a solution, how good is the evidence that you have that this solution will have the effect that you think it will? Is there evidence from like academic studies, randomized control trials? Great, fantastic. Really rigorous evidence. But maybe on a simpler level, is there evidence from other organizations and the work that they have done, or other companies and the work they have done, that people will buy this product? That this solution actually identifies a problem that people have and people are motivated to purchase your solution. More broadly, I think both of these kind of tools or approaches speak to something that is really important to the way that we try and train our entrepreneurs, train our founders, which is to try and quantify your decisions and quantify your assumptions and uncertainties as much as possible. Joey Savoy, who set up Ambitious Impact, is a huge fan and a huge nerd about weighted factor models, which are basically putting a bunch of numbers on a spreadsheet. Any kind of spreadsheet will do, to understand exactly what the inputs to a given decision are and how important these are relative to each other. Good weighted factor models have distinct criteria and options. So you are assessing a decision based on significantly different criteria rather than three things that basically track to the same overall area. If I'm choosing between career options and I have three criteria that I'm using for this, and I'm using, say, like the income, I'm using how many of my friends work in this area, and I'm using like how much time I will get off from this job. These are three seemingly kind of independent criteria, but in reality, all of these three criteria are in the box of like, how much would I personally enjoy this work? And that is a completely different criteria to say like, how useful might this work be in the world? Or how good am I at this work? And so you could have 10 criteria about how much might I enjoy this area of work. And that is like useful to an extent, but is more useful to have distinct criteria. So you're measuring both like how much might you enjoy it, how good are you at it, how useful is this in the world, and therefore you're measuring like meaningfully different things about the choice that you're trying to make. The other thing that I think is particularly useful about weighted factor models is this idea of weighting the different criteria. So that if the value of the work in the world is twice as important to me as the enjoyment that I get from it, I am modeling that in how I measure the different inputs and criteria that I use. And even just going through that process, I think, is very valuable for any kind of decision that you might make. How much more important is it to me that this product is useful to people than there is a like large margin for profit? And decisions that you will make are often having to make trade-offs between different things, and being able to quantify those trade-offs for how you think about them. There is no one right answer about how you should trade off between your personal satisfaction in a career versus like how useful it is for the world. People will have different conclusions, have different intuitions about this. But understanding for yourself how important these things are, and also being able to toy with the weights, so being able to say, okay, if I valued my personal enjoyment in my job twice as much or 3 times as much, how might that change what different areas I might go into? To take another example from the Maternal Health Initiative, this is a snapshot of part of a very large weighted factor model that we built. So I could not get the full spreadsheet to kind of fit on a screen such that you would actually be able to see this. But this is a weighted factor model that we built to decide where we would investigate piloting our work. We ultimately worked in Ghana, in the second top scoring country, but we used this model to decide where we would go to investigate working. And so about 3 months into running the charity, we visited both Sierra Leone and Ghana to identify which country we wanted to work in. We ultimately chose to work in Ghana because of something that isn't captured in this model, which is basically how good the organizations were in the country that we were working in, who we could collaborate with on the intervention. And so some things you can't easily capture in a model like this, but there's a lot of stuff that you can capture. So to take a couple of examples here, the criteria that are kind of on the screen are particularly around focusing on the size of the problem. So if we want to increase access to contraception, what is the current level of contraception use in the countries that we are going to work in? And therefore, how much potential for kind of change is there if we came in and delivered a program? It's not very useful for us. It's comparatively less useful for us to run a postpartum contraceptive uptake program in Norway as it is compared to in Ghana, because the level of existing use is so much higher. And so being able to actually go and investigate the data that exists. The nice thing about starting a charity in global health is there is a lot of data. Some are a little bit questionable how reliable it is, but there is a lot of data that you can use to help quantify decisions like this. And I think there is a lot of flexibility that you can do in this terms of modeling as well. So you'll see that in the C, D, and E columns, we have kind of go or no-go criteria. So some of the countries that came up highest for the potential need for the intervention were places often in the Sahel region, so in the kind of Saharan areas of Africa, as two white founders with some but limited experience working in difficult contexts. We did not have the skills to go and operate in a kind of in a conflict zone. We're not going to go and work in Sudan, but Sudan otherwise would come up very highly in terms of the potential for this intervention. Another thing here is to then cultivate experience that matters to build better heuristics. So I think there are two types of experience that can be particularly useful, lived experience and then transferable experience. Lived experience gets you close to the problem you're trying to solve. So a good example of this is lived experience of working in a lower income country and spending time in somewhere, if you're interested in doing global health and development work, being exposed to the kinds of realities of what it is like for people who you might ultimately end up trying to solve gives you a much broader appreciation of why these problems matter and how people approach these things. It is very easy to look, say, at the need for training of healthcare workers and being there is a lack of kind of high quality care. If you've actually been to a health facility in a lower income country, you appreciate much more the reasons why this care might be bad. And so you're not going to come in with a solution that is just completely irrelevant to the problem that you're trying to solve. Transferable experience is more about kind of broad sets of skill areas that are valuable basically any type of project that you might run. I think communications, management, and partnership building are kind of particularly good aspects of this. The nice part of transferable experience is that I think you can develop these in almost any type of role that you might currently be doing. And so I think it is worth thinking about, is there one of these skills or a kind of transferable skill that you have, that you are working on or using in your current role in whatever you're doing currently? And could you pick maybe one of these and really figure out how to become more of an expert in it? Really develop this as a core strength that you can bring to any type of work or project that you do in the future. Behaviors that produce better results. Let's talk about this. Okay, 3 main things here. I'm going to skip through this a little quicker because I think I am badly underestimating the time that I overestimating the time that I have left. Reasoning transparency is a term that's used quite a bit in effective altruism. This basically means being very clear about why you're making certain decisions, and what the uncertainties or assumptions are that you have that are going into this. So building a weighted factor model is a very good way of being transparent in your reasoning. But more broadly, I think there are kind of easy ways, some of which I've listed here, of making it clear. I think this is as useful to you yourself as a decision maker, as a person making strategic decisions on whatever kind of project you might run, as it is to other people who might engage. I think there are good reasons that for collaborators, for funders, these sorts of things, this sort of transparency is really important. But it is also very useful for your own ability to change your mind and be flexible in choosing the best plan. Being a founder involves doing lots of different things. I think this gets a little bit more kind of basic and simplistic, but I think my advice here is mostly around I use this word a lot in chatting to kind of founders on our program, but being aggressive in streamlining and in prioritizing. That it's nice to kind of say that I'm going to prioritize the work that I do, but I think often that people will be insufficiently aggressive in what it means to really do prioritization. So a good example of this is that there's an exercise you can do where you might list your kind of 15 or 20 most important things that you're working on right now, and then prioritize these things. And I think often that feels like good prioritization to people. That felt like good prioritization to me. The brutal, aggressive version of this is you take that list of 15 things, and it's not really a list of priorities if you have 15 things. You can't have 15 priorities. That is not a actual real list of priorities. That list should be maybe 3 at most. Really, it should be 1 or 2 things. And that anything that's scoring certainly beyond 5 or something, you should just cut outright. I think the idea of 80-20ing, you might have heard this in terms of the Pareto principle, is this idea that you get 80% of the value from 20% of the things that you do. I used to think about this in terms of, okay, if I get 80% of the value from 20% of the input, then I should do 10 things and just figure out for each of these 10 things what the 20% of that thing is that'll provide 80% of the value. Now I try and think about this more, that if I have 10 things, what are the 2 things out of these 10 that are going to provide the 80% of the value, and then just cut the other 8. Because realistically, you do not have the time to actually be inputting into those 10 things. And that if you really focus on the 2 things that'll provide most value and do those really well, that'll provide a lot more value than trying to do all 10 to a kind of basic level. Another thing that can be quite useful is making predictions. I think there are a variety of ways in which just having reviews and retrospectives in the decisions that you make can be very valuable for making better decisions in future. Actually being accountable for yourself in terms of why you made a decision and what the inputs were is really valuable, when otherwise you might look back in hindsight and think about a decision for quite different reasons. And then finally, we'll whip through some practical steps to build skills. The most important thing, I think, is to start something. If you are someone who is interested in entrepreneurship, interested in founding, and has not previously founded a project of any kind, then the day 1.1 is start something. I think that it is being harsh, element of a lack of creativity or kind of lateral thinking. If you feel that you are very drawn to entrepreneurship or to founding a project and have not found something in which you could start. Everyone has lots of different constraints, and so I am not saying that you should go and launch a charity in Ghana in your spare time outside of a full-time job. But I think there are a lot of kind of much smaller things that you could do as a side project during university, as a very small community initiative, as I'm going to start a blog, things that might feel less I'm building a company or building a charity, but still test your ability to actually produce something in the world that did not exist before. In the kind of most basic sense of founding something, you are, in this way, producing something that did not exist. So there are some ideas here. I think also one of the nice things about effective altruism is there are a few different kind of funding organizations that are quite receptive to funding small projects, compared to maybe like the more commercial world, where it's like much harder to get that sort of like very small seed funding for something that isn't very developed. I think some of these places will be much more receptive to, I have this idea and I think this might be really valuable. The other thing I would really advise is building a network. There is no great substitutes for just being able to learn from other people who do entrepreneurship and who are funders. And I think this example of cold emailing is a really good test of how entrepreneurial you are, how well suited you are to founding. This is in some ways like an entrepreneurial problem in itself. Can you build yourself a network of people as advisors or people you can learn from when you did not have something before? In a way that can feel uncertain, that can feel somewhat off-putting, that requires quite a significant amount of like agency. I think for cold emailing, the three things that are quite useful. Don't go emailing people who are like crazy successful, because you're not going to get to them directly. There's a certain level where you probably will actually land in someone's inbox and they will read it. And then telling them just briefly what you like about their work and a specific question or problem that you have. It's very annoying to get a request for like, I would like advice or support that does not tell you what people would like advice on, because you're now asking that person to ask you what they can help with. And now you are like you're passing the bat on basically the work. And if you're passing the bat on the work to someone who is busy, they're not going to do that work and you're not going to hear back from them. If you're a little bit earlier in kind of thinking about these things, I think freelance work can be very useful for building transferable skills. I worked as a copy editor for quite a while, and I think that alongside some of these other options that I list here can be quite useful. These are transferable skills that help you in this sort of way of like can be quite broadly applicable to many different areas. I think also the benefits of freelance work is if you can find meaningful amounts of freelance employment, it can be a really good way of creating time to then develop projects. If you can work freelance, you now have like flexibility over the number of hours that you might work to pay your bills, and it's easier to now work like 3.5 or 4.5 days a week, let's say, and now have a bit more time to work on a project that you might want to start than being married to like a 5-day-a-week job. Skill volunteering is similar, but you're not getting paid. So it's like maybe I would start with the freelancing. I think with volunteers, my general advice is that it's often a little bit more burdensome than you might think for the person who you might be volunteering for. You're providing free labor, but up front there are some not insignificant costs for the organization who you'd be volunteering with. And some of these kind of tips or steps, I think, make it a lot easier for someone to feel confident that you are worth investing in upfront as a volunteer. Finally, I think this is finally, doing hard things. In general, I think founding can be difficult. It requires some kind of traits that are testable in a lot of different domains, but that require development that I think people can get a lot better at with kind of practice and work, and don't necessarily require starting a project, handling uncertainty, just being agentic. So like just if there is a problem that you think it is important to solve, if you have a issue in your life, going and being very proactive in finding solutions for this, and then strategic thinking as well. I think, you can treat upskilling as an entrepreneurial project in itself. And I think there's a lot and a long way that you can go with this. If you are excited to found, and particularly if you are excited to found something that is maybe a little bigger, we do a lot of work on kind of scalable projects. At Ambitious Impact, we run 2 main programs, Charity Entrepreneurship and the Founding to Give program, which is our for-profit incubator. We will be opening applications again for these at the start of August. Wonderful. That is everything. And then I think we still have saved some time for a Q&A.
Yeah, give it up for you. to our speaker. Thank you so much, Ben. Okay, you can submit questions for the Q&A in Swapcard. You can go to this event in Swapcard, go to live discussion, and then you can submit questions. I've prepared one question. So you talked about your experience with Maternal Health Initiative.
Mm-hmm.
Since you stopped the charity for now, do you think it would be worthwhile to go back to it at some point and maybe try it out in different regions? You had some on the list, maybe some that were unsafe before, maybe situations have changed.
Yeah, the kind of reasons around the relative lack of value of the postpartum period broadens to kind of a lot of the countries that kind of scored highest, or we were most excited about working in, that these kind of tendencies or experiences cross-apply. The short version of this, I'm going to try and phrase this in a useful way, is that we worked in Ghana on postpartum family planning. So basically we had our expertise on our intervention of how to deliver this training around access to contraception in this post-birth period. And then we had our expertise around working in Ghana. Ghana is more of a lower middle income country. And so the gap for contraceptive use in this period was particularly high. But for a lot of other problems, actually Ghana is not the kind of most effective or most cost-effective place to work. So we kind of concluded that our leverage in Ghana was not that useful. And then if we were not that excited about the postpartum specific kind of work more broadly, then it felt like the two main aspects of value from the organization as it exists are quite weak. At that point, if we're going to work on a new intervention in a new country, that sounds an awful lot like just starting a new organization. And then I think there are a little bit more personal reasons about maybe kind of drawing a line and starting again. Certainly, I can see myself launching a project like this in future, but it might end up being on something quite different. Yeah.
Okay. Perfect. Thank you. All right. We have some questions coming in now. You can also upvote the questions that you like best. All right. So could you tell a bit more about Founding to Give? I think you talked a bit about the
Yes. The Founding to Give program, we've run this for the first time this year. This is a for-profit incubator. It's about 4 months of paid training. It's a pre-accelerator program. So you come in, you do not need an idea, and you do not need to have a co-founder. It is designed to help you find someone to work with to build a company. And to go and kind of test out different ideas and different potential product market fits in a very streamlined, fast-paced way, to then at the end of the program launch a company based on the kind of co-founder product fit that you're most excited about. We are just about to kind of announce that we'll be running this again in January of next year. We provide a lot of kind of mentorship and guidance in how to kind of build and run a successful company. We have people who run this who have a lot of venture capital experience and these sorts of things that I think is very valuable. We don't take any equity as well. So the main value that we see is we ask founders to make a commitment to donating a proportion of the exit earnings they would make, I believe over $1 million. And then in return for that, we don't ask for anything. We provide the kind of service in helping you get launched. Hopefully, we're going to see some of these companies. We've launched about 11 out of this first cohort. Then kind of grow, potentially join kind of larger, more well-known accelerators, something like Y Combinator, places like this.
Perfect. Thank you. Next question we have is, what is the historical success rate of charities that AIM has incubated? How many continue to operate versus are shut down? Do you think this number could be improved?
Yeah, this is a thing that we are working on all the time. The very rough heuristic is something like, I think, maybe 40%-ish are charities that we are phenomenally excited about. We think they're basically field leaders in the work that they do, and organizations that are now operating at 20, 30, 40 staff, often kind of regionally, nationally, or across many different countries. Another 40 to 50% are either kind of steady. We think they do solid work, but we don't think they are kind of moonshots on track to kind of change their field. or they're just a bit earlier. So they launched last year, we're a bit more uncertain about kind of where they're at, and then maybe like 10% end up closing down. So that's the case for like me. I think, another organization, the Center for Effective Aid Policy, shut down last year as well.
We have a question about weighted factor models. Yay. This person says they struggle with how to decide on the weights in the weighted factor models because they can influence the outcomes a lot. Is there a good tip on how to imagine for myself whether one factor is twice as important for me as the other? I
think it's hard. I think my best advice is to use it as a flexible tool. So rather than trying to model one correct answer, model multiple potential scenarios, and then use that for kind of broader decision making where you might bring in other kind of softer considerations. So you might, in this case, model a scenario where you prioritize your personal enjoyment quite highly, model a scenario where you get really intense about just the impact you're having on the world, and model another scenario as well. And this can be then very useful in terms of seeing what jobs or what kind of paths then pan out.
Thank you. Okay, next question. How much time would you allocate to analysis, especially in the starting phase, versus time allocated to building your product or service?
I think this depends a little bit on your funding situation. So maybe some of our advice is a little bit more suited to our charities that generally have funding for kind of their first 12, 18 months. There's more time to really focus on getting it right. And you're investing more upfront. If you are in a kind of more pressed funding situation, you might need to run a little quicker to producing an MVP, such that you might be able to survive.
Okay, I think we have time for one more question. How do you account for uncertainty in evaluating projects with potential long-term effects when there's little evidence for impact currently?
Yeah, this is where you do have to rely a bit more on those intermediate metrics, and you want to make then transparent assumptions about how those intermediate metrics are translating into real world impact. I think being transparent in those assumptions is really valuable for then if I'm making a decision on whether to donate to your organization or to fund you, being able to understand whether I largely agree with how you're doing this. But if you're doing policy change that might not happen for 3 or 5 years, you can use intermediate metrics as just are you actually speaking to the government? Are you actually producing legislation or policy briefs that are getting used? If you've not had any conversations with anyone who's a decision maker, it seems very unlikely that you're actually going to have real impact, no matter how neat or cool that impact would be if you did have it.
Okay, perfect. We have one last question maybe about your previous work at Effective Self-Help.
Yes.
Can you tell us a bit about what happened with that project, looking back on that now?
This is a project I started basically to do research into well-being and productivity interventions that people can self-help. So basically things that you can do yourself to improve your either well-being or productivity, trying to get a little bit away from the kind of information environment that I think is very, here's a celebrity or a famous scientist and they say that this thing is good, and a bit more look at the academic research or just pool a lot of different experts' opinions and put these together. I'm still kind of excited about this. I chose not to, left this program to start the charity because I think that good information around these things is useful, but the bigger bottleneck is just getting people to actually take action. And so I was a little less enthusiastic about how useful this would be, because I think the bigger bottleneck is just people actually doing things full stop to improve their well-being and productivity.
Okay, perfect. Thank you so much for the talk, and thank all of you for your insightful questions. If you'd like to continue this conversation in a bit of a more informal setting, then Ben will host office hours now in the room Catherine, and you can just follow along with us and we'll meet you there. Thank you.
Thank you.